Hello, everyone, and welcome to the executive summary on the monitoring report on the Code of Practice on Accessibility of Public Services and Information Provided by Public Bodies. My name is Naomi Oldenburg, and I am responsible for monitoring this Code of Practice, and I am also the Access Officer for the National Disability Authority. So, get into the executive summary now. The National Disability Authority is the NDA is the independent statutory body that provides information and advice to the government on policy and practice relevant to the lives of persons with disabilities. We work through our Centre for Excellence in Universal Design, CEUD, to promote the universal design of the built and digital environments, as well as services and systems, so that they can be easily accessed, understood, and used by everyone, including persons with disabilities. Under Part 2, Section 8 of the National Disability Authority Act, the NDA has a role to monitor the implementation of codes of practice approved by the Minister and to report the findings. This includes the Code of Practice on Accessibility of Public Services and Information, which will be referred to as the Code from now on. This code guides public bodies to meet requirements under Section 26, 27, and 28 of the Disability Act. For the purposes of this monitoring activity, the NDA carried out a desk-based evaluation of conformance of all public bodies against specific statutory requirements using their websites regarding Section 26 of the Disability Act. As set out under Section 26 of the Disability Act, public bodies have a statutory requirement to appoint an access officer to the organization. The Act states each head of a public body shall authorize at least one of his or her officers, referred to in this Act as access officers, to provide or arrange for and coordinate the provision of assistance and guidance to persons with disabilities in accessing its services. The NDA undertook a desk-based monitoring activity, which consisted of analyzing the websites of public bodies considered to be included in the definition of public bodies under Part 3 of the Disability Act. In 2021, the websites of each public body were monitored against an indicator composed of 3 criteria to evaluate if the required information was promoted with regards to the access officer. The 3 criteria assessed were the promotion of the appointment of an access officer on the website, information on the website on how to contact the access officer, and a variety of communication channels available on the website for contacting them. The NDA monitoring team evaluated the information provided on the websites of 292 public bodies. This was later adjusted to 281, and then made an assessment on conformance against the criteria, which were recorded into a database. Initial findings were communicated to departments for dissemination to public bodies under their remit. Public bodies and departments were given time to respond with updated information, which was then incorporated into the final analysis and report. Further information on the methodology of this exercise is contained in the main report, and details from each department following this exercise are available in Appendix A. Initial findings reported that 47.7% of public bodies promoted the appointment of an access officer on their public website, whereas 52.3% of public bodies appeared to have no information on their websites concerning access officers. This is shown on the pie chart in this slide. Following on from the issuing of the draft report and considering the resulting updated information provided to us by public bodies, final results show that 192 or 68.3% of public bodies promoted the appointment of an access officer on their public website, whereas 89 or 31.7% of public bodies appear to have no information on their websites concerning access officers. This is shown on the pie chart here. Overall, in our initial monitoring, only 34.9% of public bodies met all three criteria of the indicator with regards to access officers. However, following the issuing of the initial draft of this report, there was an improvement amongst public bodies across all three criteria. So in our final analysis overall, a total of 165 or 58.7% of public bodies met all three criteria of the indicator, while 41.3% did not. This result is illustrated on the pie chart here. Overall, since the issuing of the draft report, the NDA notes there has been a marked improvement in the promotion of access officers on public body websites. For example, the promotion of the appointment of an access officer on public body websites jumped from 47.7% of all public bodies to 68.3% of all public bodies. This represents a 43.3% increase in the promotion of access officers on public body websites monitored. This result is illustrated on the chart here. In addition, there was marked improvement in the provision of access officers' contact information, facilitating written and spoken information, and therefore meeting all criteria under the indicator, improving from 34.9% of public bodies monitored to 58.7% of public bodies monitored. This represents a 68.4% improvement. Precise measuring of the impact of the NDA's monitoring on these numbers is difficult, as there are many factors which can contribute to the increased provision and promotion of access officers across the public service. However, of the 75 responses the NDA received, which provided updated information on public websites, 82.7% of the responses indicated that the information was updated as a result of the draft report being issued. 17.3% of the responses did not specify. However, no response stated that the report had no impact on the information on the websites of public bodies who responded. While this monitoring exercise has resulted in marked improvement in the promotion of access officers on public body websites, there are still 116 public bodies which did not meet the requirements under the access officer indicator. It is therefore clear the public bodies still need to improve their awareness of the responsibilities under Section 26 of the Disability Act and to take relevant action to ensure that they make the changes and information available to the public. The NDA advises public bodies to update their internal procedures if the appropriate processes and appointments are not in place. In addition to this, public bodies with an access officer in place must ensure that the access officer has appropriate training, resources, and information to support them to carry out their duties as specified by the Disability Act. Guidance from the NDA is available in the Access Officer Guidance for Public Bodies document regarding the appointment, training, duties, and processes surrounding access officers. Further recommendations and advice can be found in the full report. If the versions of the report available on the NDA website are not accessible to you, please make a request via accessofficer@nda.ie or on 016080 437. Thank you very much, everyone.